Good day, everyone, and thank you once again for joining us. I'm very pleased to say that we have currently no active cases of COVID-19 in Yukon. The measures that we continue to take, both individually and as a collective, they are addressing the spread of the virus, and I believe that these measures are clearly working. So thank you. To all Yukoners who continue to play their part in this collective effort to protect our territory. Thank you very, very much. Our government's top priorities remain to protect the health and safety of Yukoners, and each Yukoner has a role to play in this. Dr. Hanley spoke of the Safe Six, the 6 steps that you can take. Number 1, practicing physical distancing by staying 2 meters apart from those who do not live in your household. Number 2, washing your hands often and for 20 seconds, at least 20 seconds. Number 3, staying home if you are sick. Number 4, limiting gatherings to no more than 10 people. Limiting non-essential travel to communities. And finally, number 6, self-isolating as required, including if you are returning to the territory. We are also looking into how to ease restrictions that we have introduced to help contain the spread of COVID-19. We know that our economy has been significantly impacted by the measures that we have taken to date. There is no doubt that these measures have been disruptive and challenging for businesses. It has been great to see businesses across the territory demonstrating leadership with this ever-evolving situation. Many have taken time to consider how the current recommendations from the Chief Medical Officer of Health affect their operations and have planned out how to continue to provide quality goods and services to customers safely. Local golf courses are starting to open. Recycling facilities are coming back online. I got my bike repaired at the local bike shop just the other week as well. And many other businesses are carefully reintroducing services for Yukoners in a way that allows for physical distancing, proper hygiene, and safety for workers and for customers. Last Friday, along with Ministers Pillay and Ministers Dendies, I met with the Business Advisory Council. It continues to do a fantastic job of providing our government with information and advice so that we can be responsive to the evolving needs of our diverse business community and work together to help and to ensure that our economy rebounds from this pandemic. There is a strong understanding from the Business Advisory Council that we need to proceed in a careful and thoughtful manner, taking measured steps that are based on the best public health information. Now, you've all heard from many premiers from many different regions across this great nation the same thing. We cannot just hit a switch and return to normal. It's extremely important information. We cannot afford a false start. Nobody wants to ease restrictions prematurely and then reintroduce them because we have moved too quickly. This has happened in other parts of the world. I know the business community recognizes the importance of proper planning for operations and introducing measures to ensure physical distancing and proper hygiene can be maintained. This is important for both workers and customers to ensure that everyone is confident that the health precautions are in place, but yet comfortable returning to workplaces and business facilities as well. I value the input of the private sector immensely and all that they are doing to manage this situation, and we can't thank you enough. I also want to thank all of the members of the Business Advisory Council and their chair, Rich Thompson, for working together with us on this. We will continue to work with them as we develop plans going forward and continue to provide support where it is needed. Yesterday, Minister Mostyn announced a $3.56 million additional support for Yukon's aviation industry in partnership with the federal government. We recognize the essential role the aviation sector plays in keeping our communities connected and transporting important goods as well as critical medical cargo like COVID-19 tests. Our government is proud to support our aviation industry, and we will continue to support other areas of the economy as well. Again, it has been great to see businesses adapting to the current situation. We recognize that there are some businesses that cannot operate in this time, including bars and personal service establishments like hair salons, massage therapists, which have been ordered to remain closed to protect public health. Other businesses can choose to operate, providing that they ensure physical distancing and good hygiene as well. Last week, food truck operators and community markets were provided with guidelines of how to operate with the current public health recommendations. I know with the warm weather, Yukoners are eager to get outside and will be happy to see the comforts of local food on offer in the weeks to come. There are general guidelines for businesses being developed that we look forward to releasing very soon, to help businesses determine how to operate in the safest, most responsible way to their staff and to their customers. We are looking at relaxing current restrictions. We need to take a coordinated approach to ensure public health measures are being taken, and the distinct needs of the different communities are also being taken into consideration. We remain in close contact with our First Nation and municipal partners to get their perspectives and keep them informed. They too recognize that if we move too quickly without the proper planning and coordination, we risk increasing the spread of COVID-19 in our territory, which nobody wants. My team continues to evaluate how and when restrictions are lifted by considering the advice of Dr. Hanley and the unique circumstances of our territory. Other jurisdictions are releasing plans for reopening and lifting restrictions tailored to the circumstances in these provinces, and each plan will look different. Safety measures are far more restrictive in other provinces than in Yukon. Their government responses were, in many cases, much more severe than our own. We had the benefit of seeing the situation unfold before it reached our territory, and we were able to take proactive approach to introducing safety measures. This approach has been challenging, but it has been the right approach. I understand Dr. Hanley will be discussing some modeling details as well to speak to that. Our low case count shows that the approach is effective, and we must remain vigilant as we look towards moving to the next stages. Again, the easing of restrictions will be gradual and done in a way that protects our public health. Before I finish, I want to take a moment to recognize that it is Mental Health Week. Everyone is impacted by this situation, and it has not been easy. Taking care of mental health is extremely important, especially now, as we adjust to new realities. For those who are in need of mental health supports, please know you are not alone. Resources are available. The mental health and wellness hubs continue to provide services throughout the Yukon, and counseling services are available over the phone by calling 1-866-456-3838. So that's 1-866-456-3838. I want to thank all of the mental health workers who are working to support Yukoners in these trying times throughout the territory. And I also want to thank all Yukoners who are taking the time to check in on friends and neighbors and family members. Keep it up. It really does make a difference. We're all in this together, and we all need to take care of each other and to pull through these challenging times. And I want to close by once again thanking all Yukoners for all of their efforts to help our territory stay strong and stay healthy. Thank you very much. Masi cho, Gwanisjich.
Thank you, Premier. As we enter the third week with no cases of COVID-19, I'm sure that many of you, just like me, watch the daily numbers with a certain degree of trepidation. We have worked so hard for so long to ensure that Yukoners are protected in the best way possible, and to see that number stabilize is a reaffirmation that so far we're doing the right thing. It's a cause for celebration, but not for relaxation. Our testing has continued so that now well over 1,000 Yukoners have been tested and found to be negative. We have expanded the criteria for testing, adding in more symptoms for people who have traveled and looking among vulnerable populations for possible signs of community spread. So far, all of those tests have been negative, and our test positivity rate remains a satisfying 1%. These numbers, while reassuring, do not mean we're in the clear. On the contrary, one of my fears is that we will move too quickly in trying to get back to normal. As we talked about last week, it is critical that we balance the effects of restrictions on our lives with the risks to Yukoners' health posed by COVID's fickle and dangerous character. We're moving towards lifting restrictions, and we're doing that in a careful, gradual, evidence-based way that makes sense for Yukon. We need to take small steps, watch what happens, and if all stays okay, take another small step. We are working with a variety of partners as we look forward, and we're using modeling to show us the impacts of COVID-19 restrictions as well as the realities of what could happen if our situation were to change. Flattening the curve became a household expression only a couple of months ago. In Yukon, we have yet to experience the curve, only because of all the work we have done to limit COVID's spread. I have referred over the past few weeks to our modeling team and the work that they are doing. I'm not going to go into too much detail here. We will give a fuller technical briefing when we're ready, but I can give an overview of some of the work. Keep in mind there are a few key principles about modeling. We should remember what modeling can show us. It can show us possibilities, and it's not meant to be a prediction. There are a couple of useful sayings about modeling. One that I really like is, all models are wrong, some are useful. And another is that models are not a snapshot of the future. They always describe a range of possibilities, and those possibilities are highly sensitive to our actions. In other words, modeling can help us to map out scenarios where we can play with various options of how interventions or behaviors could alter the results. Some of our modeling work is starting to give us data. You might be wondering why it can take so long to develop models. By far the most time is spent in researching models and appropriate values to insert into models, as well as researching and verifying data sources. Examples of data sources could include specific characteristics of the virus, like how easily does it spread, hospital capacity, staffing needs, and the amount of time it takes for contact tracing and case investigation, as well as details of population structure. If we want to look at population behaviors, then we need all kinds of other data sources. Some of the areas of particular interest to us in Yukon are not the same as the large jurisdictions. As I said, we don't have a COVID curve to analyze. And as always, our population numbers mean that projections are difficult to make. But examining risk of imported cases or importation risk is one area that is really important to us. Another area that I mentioned last week is modeling the effectiveness and the health effects of imposing public health measures such as physical distancing and self-isolation and closure of services on a population. Other areas might help us to predict PPE requirements or estimate health system capacity and healthcare worker capacity. Some of the early products that we have include a model where we can input the effect of a single imported case of COVID, or even multiple cases imported at the same time, on how that would affect or could have affected our population and our healthcare capacity if there were no physical distancing or self-isolation measures in place in Yukon. For example, we ran the estimates for what could happen with either a single COVID case appearing among us or 10 cases at once occurring in mid-March, at a time when we already had travel restrictions coming into Canada and around the time when border restrictions were just being implemented in Yukon. Here's what could have happened. If we did not have control measures in place, we could have had 2,500 cases by May 1st and over 150 people needing hospitalization. Thanks to everyone's work in adhering to physical distancing and self-isolation after travel, we see a much different reality. Let's say a group of people came back from an event where 10 of them were carrying COVID. In that case, we could have seen over 7,000 cases by May 1st and close to 1,000 hospitalizations, all from one importation of several people infected at the same time. Needless to say, our health system could easily be overwhelmed, even in the first scenario, not to mention the second. Our COVID story in Yukon has been punctuated by these periodic importations, and these may well continue to occur. But instead of being overwhelmed, we remain at a level where COVID is hardly visible. Who does not want to keep it that way? When we look to recovery, our reality is different than anyone else's, which is why we're looking to a built-in Yukon response to reopen, built on the federal framework. We are in an enviable position, and we want to stay here. We need flexible, actionable Yukon-built solutions for any situation that may arise, so that we can all as Yukoners live the safest and fullest lives possible while we wait for this crisis to end. This virus has wrought destruction and tragedy elsewhere in the world. When people say things will never be the same again, I think they're right. Life may continue to be different, and let's hope in some ways life will be better than before. One thing this virus has highlighted, though, is how we are inextricably connected and reliant on one another. This understanding is something we cannot afford to lose now or even after the pandemic is over. Yukoners hold each other up in so many ways. We always have. But this is as strong a reminder as we could have of the need we will always have for that support. The signs people have put up along the Alaska Highway remind us of the goods and the good traveling up to sustain us, brought to us by truck drivers most of us will never meet. We know workers in continuing care and home care are working day and night to ensure that Yukoners who deserve the best care are safe, comfortable, and enjoy the human connections we all need, as do the thousands of workers and volunteers who continue to show up in so many different ways to help those who cannot put food on the table right now, those battling addictions, youth, the elderly, those with disabilities. Our challenge is to wait another day at a time, another week, another month, or many, to see our family members, to welcome tourists, to get back to a normal workplace, or to return to the activities we value. However, as each action we take or change we make contributes to a small part of the safety net for our most vulnerable, these kindnesses also make us whole, a whole, strong community which commits to protecting each elder, each person that faces financial losses or mental distress, each child that wonders why things are so different. We'll definitely get back to a place where we can do all the things we value at whatever distance we choose. And we will get back there on the safest path so that we can all get back together. Thank you. Masicho. Merci.
Thank you, Premier Silver. Thank you, Dr. Hanley. We'll go now to the phone lines. We'll begin with Tim from CKRW.
Hi, good afternoon. Actually, this start with the Premier first. Just wanted to ask, the opposition has written a letter to your office in regards to getting back into the legislature, even for just for a short sitting, to ask some questions about the order in council and to form a legislative committee to deal with the COVID-19. Just have you read the letter? What is your response to potentially having a short sitting?
Thanks, Tim. So again, no provincial legislatures are meeting right now. We worked with opposition parties to pass a budget in March and adjourned the Legislative Assembly to allow us to focus on addressing COVID-19. Both opposition parties agreed with this. In March, I committed to creating an opportunity for future scrutiny of the year's budget, and we are still committed to that. And we will be sharing details on that shortly. But right now, my team is absolutely focused on the important work that's needed immediately.
Okay, thank you. And can I switch gears with Dr. Hanley for a second? And I'll even admit this is a little personal question on my behalf. Allergies. It is allergy season, and some of those, symptoms, allergy symptoms, kind of mirror potential COVID symptoms. What do you say to those who are suffering from allergies at this time, and especially going out with public and maybe have an unintentional sneeze when it's, allergy related?
That's a really good question, Tim, and sneezing is still allowed in territory. Let me just be clear. It's also sometimes can be confusing. Is this my allergy or is this something else? And so one of the things that we're advising to our healthcare providers is that when we're talking about testing for a new onset of respiratory symptoms, cough, fever, shortness of breath, we're really talking about a new onset of something that is not otherwise explainable or obvious. So if it's pretty obvious to you, this is the time that you expect sneezing and runny nose or sore throat or tickle in the throat, and is consistent with your allergies, I'm not particularly worried about that, and nor do you need to be. If it's something different, if it's something unusual, especially if there's a fever involved, that would be the potential that there's something different going on, then that would be the opportunity to do the self-assessment or phone 811 or ask. Keep in mind that these ones that are not associated with travel are low-risk events. As I said before, we're widening the net, being just a little extra careful to pick up any signals. So I'm not particularly worried about symptoms that are consistent with something that you know.
Thank you, Tim. We'll move to Gabrielle, Whitehorse Star.
Hi. In regards to some of the recommendations for businesses, as businesses reopen, there are still a lot of reasons why an employee might not feel comfortable returning to work, whether they're perhaps immunocompromised or someone in their household is. Are there recommendations for ensuring that everyone who returns to work feels safe and prepared to do so?
I can start. Yeah. I think it's a good question that employees need to be comfortable with the workplace and vice versa. And so a workplace needs, part of the workplace of a setup is the setup of a workplace, is that all of those details about how to promote, for instance, physical distancing within a workplace, how to make sure that employees who are who are sick are staying home and are supported to do so, that everyone has the access to the information they need, and that they're clear about their place in the workplace, whether that's working from home or working within the workplace. So I do think a lot of that is around communication, assuring good lines of communication, but a well-structured workplace at this time, in sort of COVID-conscious times, is a safe workplace, and that would be a workplace we could consider safe even for people who may have underlying medical conditions or immunocompromise.
Yeah, and I'll pick up on that. It's a great question, and it's something that we've been talking about in our bilateral and whole of government conversations upstairs. We've had conversations in the past and programs for sick leave provisions for workers in the Yukon, and we come up with these provisions based upon best evidence at the time. Now that we're moving into the next phases and we're looking at talking about recovery and currently with businesses, we're asking the question, which businesses could be open right now, but maybe they're not open. Which businesses aren't open now because of economic reasons? Well, we're asking the same question about the workers, making sure that our workers are protected. Who's feeling in a situation where they still need provisions to stay at home if that's necessary when we're opening up? That's definitely something that's on our minds right now. And if we look at previous announcements of support, we were there when COVID first started being a consideration, and we will be there to support workers as we get into the next phase of reopening the economy as well.
Next question, Gabrielle.
Yeah, my follow-up is about modeling. You said that modeling isn't always correct, but it's sometimes useful. I'm just wondering how much modeling informs, say, how much PPE we request, or how much that affects how we staff healthcare services.
Yes, so PPE, as you know, is a very complex equation to work out. Most of the PPE estimations are not necessarily made on modeling, but modeling can help to project future scenarios of increased need. Hang on a sec. Sorry, just a dry throat. So for instance, a PPE, we do have a calculator, more or less, of that takes into account existing inventory, projected supplies for where the supplies are coming from, what sources and what numbers. We've centralized the distribution of PPE for the whole territory. We've been developing guidance for particular sectors of work to guide healthcare workers or allied professionals and other sectors on what PPE for what situations. And then we have a calculation based on existing burn rate with then margins of error, and sort of all that kind of goes into projecting ongoing and estimated needs in the weeks to come. So the modeling then has a role in, okay, what if things get worse? What if there's more cases? What if there's community spread? What if our guidelines change? Then how do you factor in changes to PPE estimates in that case?
And I'll just add to that too. Dr. Hanley and I had a great conversation earlier today about some of the numbers that he provided about what if for today, the modeling numbers that he had for today, if we were going to see some of those earlier cases. And I just want to share, that's extremely important information as far as modeling goes for where we are today in Yukon. We're at a place where there's no active cases and only 11 cases in total because of the good work that Yukoners have done to self-isolate, to do all those things to reduce the curve. I got a letter from Minister Stryker, which is, it's pretty interesting information. It was from the organizers, the amazing organizers of the Arctic Winter Games. And it says, that the organizers received a message from a Games spectator from away, writing regarding ticket reimbursement. And the person told the folks at the Arctic Winter Games organization crew, and I'm quoting here, "If you ever needed validation for the hassle of canceling the games, I can relay that another person from my jurisdiction would have been in Whitehorse for the games. They ended up with COVID and were super sick for the 2 weeks right about when they would have been in the Yukon." So again, I think that speaks to, the importance of, just one or two cases, and we're not out of the woods yet. One or two cases that could come to a community for a large gathering like that, but also into our more rural communities. For even smaller gatherings, it's still really important that this information is being relayed today to Yukoners, because we really need you to be just as vigilant now as you have been as we successfully reduced the curve to not even have a curve. So it's just, I thought that was really important information to share at this time. And thank you to Minister Stryker and to the crew of organizers at the Arctic Winter Games for that information.
Thank you. We'll move now to Gord, Yukon News.
Yes, with the news of the performance issues with the Spartan testing machine, how has that been affecting testing in the Yukon?
Yes, so Spartan was on our radar, but we have never been in a position of counting on the Spartan to arrive. And our information is that it still is, that Health Canada is still expecting that we will get to a point of being able to receive and to use Spartans. So we see these as a really convenient tool for adding to our testing capacity, especially in rural settings. But we have always estimated that this was at least weeks, if not months away in terms of adding to our testing capacity. So I think it delays something that would be a useful addition to our armamentarium, but not an essential tool. And we can certainly continue to carry on as we have with the excellent lab service that we enjoy through BCCDC, the great turnaround time and the reliability of that test is still basically the gold standard test.
Next question, Gord.
Is there I guess a ballpark timeline you could give on when a plan would be ready for reopening?
We don't have dates to announce at this point. Again, it's that balance between making sure that we reduce the curve, reduce the strain on the medical community, on the hospitals, but also making sure that if we can accomplish those two things, being able to support the businesses that can be open now and moving into that next phase, which is an active conversation right now. And we again are working hand in glove with Brandon, Dr. Hanley, and his team to provide the recommendations to which those policies will be decided upon. But we're not here today with announcement of specific dates.
Yeah, and if I might add two parts. One is to echo the part about what I might call the phase zero, which is the current state where we are now. So there's a lot of work just in supporting reopening of businesses, especially, but also activities such as some of the upcoming camping activities and outdoor-based day camps and other areas that we have actually never closed. So the allied health professionals were working very hard with the allied health professionals and getting some guidance together. So literally in these days to help them in getting back to work, where many of them had to close for various reasons or at least to pull back. So giving that guidance based on where we are now for things we have never closed is a really important phase that we're in right now, and that's really taking up a lot of concentration of our activities. The second part I wanted to say is that you will note that the federal framework has now been released for setting the criteria and the general guidance for phases of reopening, and that is the structure with which we're working very closely, and including very frequent conversations with our counterparts in the rest of Canada.
And just again, on that as well, some of the other plans that you've seen dates released in other jurisdictions, that will get them close to where we are now as far as who can be open, those types of things. I know in Saskatchewan, one of the dates was May 19th for certain things to be reopened, and that would basically get them to where we are with the non-essential services that we've already said didn't have to close, just making sure that they're adhering to the guidelines, and that will be basically what you're seeing right across the nation. There is a coordinated effort. We speak every week with the premiers, and every week with the premiers and the Prime Minister and the Deputy Prime Minister. It is a coordinated effort based upon the First Minister's ministers' recommendations, and so again, we're in a good place because we didn't have to unravel as many strict guidelines and requirements that other jurisdictions had to do.
Thank you. We'll go now to Chris at CBC.
Thanks. My first question is for Dr. Hanley. I guess we've seen in other jurisdictions, largely in the United States, some pretty serious concerns that I guess aggressive reopening plans are highly likely to trigger second waves of cases in those jurisdictions. So I guess from the Yukon's perspective, when it comes to formulating a reopening plan, how much of that plan, I guess, hinges on what happens in other places?
We're obviously paying close attention to not just states like Georgia or Alaska next door, many of the other states as they pursue their individual plans towards reopening at various stages of the pandemic, but of course also globally, and looking with keen interest at the experience of other countries or other regions or states, and including the various provinces. One thing that makes us distinct from most other places, I mean, you might compare us in some ways to New Zealand, is that we have, of course, the border restrictions. And to me, a fundamental part of continuing the conversation on reopening is maintaining strict controls at the border until our importation risk goes down to a reasonable level where we can be more confident about that going to a negligible risk or a risk that's equivalent to Yukon. So I think that is really what gives us the ability to contemplate reopening in a safe way, along with our continued emphasis on the public health measures, on maintaining the safe six. So those two are fundamental to our ability to project this as something that we can be successful at.
Next question, Chris.
Yeah, thanks. Second question is for the Premier. Last week, your government issued new orders under the Civil Emergency Measures Act. There are a whole bunch of them, but there are two I want to sort of circle in on. One provides the authority for deputy ministers to alter terms of government contracts, and deputy ministers can also extend legislative timelines set out in Yukon laws. Can you explain why deputy ministers need these two particular powers, and I guess what measures will be taken to ensure that those powers are not misused by the civil service?
So again, as we invoke the Civil Emergency Measures Act, there is certain provisions that we have to provide to the authorities necessary in these extraordinary times. And these are fail-safe mechanisms that allow us to move on our feet and to make sure that while we're addressing the specific needs of these unprecedented times, we also have the ability to work quickly and to deal with things on a case-by-case basis. We saw a similar provision with recommendations at the border when it came to the folks wanting to appeal those decisions. And what we see in those mechanisms, and another consideration where the minister then has the authority to take a look on a case-by-case basis. These measures are in place to improve the measures and to make sure that the safety of Yukoners are utmost in our mind when we make these decisions.
Thank you. We'll move now to Julien, Aurore Boréal.
Excuse me.
Oui, ma question, ça, Hanley, c'est, on parle de la réouverture, on parle aussi de l'été qui arrive. C'est quoi?
We're having trouble hearing you. Can you please repeat your question?
Oui, avec qui arrive, la question est pour M. Hanley. C'est quoi la situation en jour d'été parce que zone grise, mais les garderies qui sont encore ouvertes?
So the question is for Dr. Hanley. For Dr. Hanley, What is the situation for the summer with summer camps and daycares being closed still? How do you envision the summer period?
Donc je vais répondre en français et puis en anglais. La question, c'est la situation pour les garderies et qu'est-ce qu'on prévoit pour l'été. Donc, pour le moment, les garderies sont ouvertes pour les enfants des parents qui sont désignés comme essentiels. Donc, on examine à ce moment la situation pour les garderies pour l'été avec les autres mesures ou les autres cadres pour une réouverture. Donc, on ne peut pas dire pour le moment, mais c'est une partie de ce qu'on va expliquer en plus de détails quand on a le plan. Pour les camps, ça dépend de camps, mais on a déjà reçu quelques plans pour les camps qu'on examine et si on peut suivre les plans, suivre les mesures, on peut continuer avec les plans pour un camp. Donc, c'est souvent modifié selon les conditions qu'on a maintenant, mais les camps ne sont pas fermés pour la plupart. Ça dépend s'ils peuvent continuer les camps selon les conditions qu'on a en place à ce moment. Donc, je vais juste répéter en anglais. The question was about the daycares and what are the plans for daycares for the summer and for camps. And I'm saying that obviously daycares are part of what we're examining as part of the reopening plans, and so more on that when we have the plan. For the moment, the daycares are open for children of essential workers, as you know. The second part is about camps, and we are already receiving some ideas or plans for some of the various summer camps. We will be able to give more detail again as we go, but those camps that can modify their activities to be in line with the physical distancing and the other public health measures around gatherings will be able to for the large part be able to pursue camps with modified activities. So an example might be where there's contact sports. Those are probably not going to be in the near future feasible activities, but where you can have activities that are non-contact, where you can observe spacing, or if you have say hiking or bicycle riding as part of those activities where you can observe that spacing and have smaller gatherings. Those are the types of things that we can foresee going ahead.
Prochaine question.
Oui, je me demandais si c'était possible pour le docteur Hanley de répéter le segment en français où il parlait qu'il allait présenter un peu d'un modèle de réouverture pour le Yukon.
So the question is for Dr. Hanley. Would it be possible to say a few words in French about the plan to reopen the activities for the Yukon?
En plus que j'ai déjà expliqué. C'est juste pour être précis.
Oui, surtout sur les modèles techniques.
Sur les...
Like technical models, but in French, en français.
Ah, d'accord, ok. Donc, oui, on a expliqué pendant mon monologue, j'ai parlé un peu les modèles qu'on a en place et qu'on continue de travailler avec. Mais un modèle, par exemple, qui est déjà en place, a démontré que si on avait un cas importé, un cas avec COVID qui était arrivé au Yukon de dehors avec la maladie de COVID, ça pouvait résulté dans des centaines de cas et avec plus de, on a dit 1500 cas par exemple, et avec 150 cas d'hospitalisation. Donc, c'est juste pour démontrer que sans les mesures physiques, sans la séparation, sans l'auto-isolation, on peut avoir un impact énorme sur le système de santé et sur la population, même avec un cas qui était introduit, qui est importé au Yukon. Et donc, avec, par exemple, 10 cas similaires au même temps, on peut avoir jusqu'aux 7000 cas et 600 cas d'hospitalisation associés avec une présentation comme ça. Donc, c'est juste pour emphasiser l'importance de continuer avec les mesures qu'on a en place avec la distance physique et l'auto-isolation en particulier.
Merci. We'll go next to Claudiane, Radio-Canada.
Oui, Dr. Hanley, donc vous dites que le Yukon n'a pas connu la courbe des autres provinces ou territoires. En quoi est-ce que les systèmes de modélisation vous sont utiles en ce moment? Vous en servez pourquoi?
So given that the Yukon didn't follow the same kind of curve that we saw in other provinces and territories, how are models helping you right now making plans for the future?
Oui, donc c'est une bonne question pour pourquoi on a les modèles. Et c'est vrai qu'on a les modèles peut-être pour les pas vraiment pour poser les questions sur la continuation de courbe, mais pour les autres questions. Et une question est la risque, comme j'ai expliqué, la risque associé avec un cas d'importation ou avec, ça c'est un modèle, on peut jouer un peu avec. Si on a de temps en temps un cas importé au Yukon, quels sont les effets avec les mesures différentes, par exemple l'application des mesures ou pas de distance physique. Un autre exemple, c'est un travail avec Colombie-Britannique et avec l'Agence Santé publique, c'est de voir les effets des mesures, les effets directs des mesures qu'on a en place. Par exemple, les effets secondaires de les besoins de santé qui ne sont pas répandus. Donc, si on a des effets secondaires des mesures qu'on a en place. Donc, on a un effort d'avoir la bonne balance entre la protection contre COVID, mais l'accès aux santé pour les autres raisons. Et un autre, c'est pour estimer les nombres ou les besoins pour les fournissements de protection de PPE, la question de PPE. Donc, plusieurs autres modèles et on va revenir, je ne sais pas exactement quand, mais on a un intérêt de revenir avec plus d'une explication technique sur cet exercice avec des modèles.
Prochaine question, Claudiane.
Juste pour les fins de la radio, là, quel est le principal facteur présentement dans votre prise de décision pour l'assouplissement ou de garder les restrictions en place? Sur quoi est-ce qu'on se base là, pour prendre cette décision-là?
So the question is, what would be the most important factor in making the decision of reopening the economy and the activities in the Yukon?
Donc, on revient de la question de balance. Parce qu'on sait qu'on est bien protégé à ce moment et on peut rester, j'espère, on peut rester dans un état de protection des effets de COVID, mais aussi on sait que les restrictions ont des effets secondaires. Donc, les raisons pour réouvrir, c'est pour les raisons pour avoir un retour d'une vie, ce qu'on appelle le nouveau normal, pour avoir plus d'activités économiques, pour avoir plus de liberté personnelle, pour avoir un meilleur état de santé mentale et pour avoir plus d'accès pour les besoins de santé. Donc, tout ça, c'est pour retrouver la balance selon la situation, selon l'état qu'on a à ce moment, tout restant sur la poursuivance des mesures de santé publique, les mesures physiques, l'auto-isolation et les contrôles sur les frontières.
Is there anyone on the phone lines that I may have missed? That's all the time we have for today. Thank you for your time. The next COVID-19 update will be Friday, May 8th at 2 p.m.